Last two committees are going to have brief presentations tonight, but are extremely critical moving forward. The evolution of DHP is such that certain things have to be at the beginning and then you evolve to other needs. The Practice Transformation Committee is a very key committee. If we talk about the patient experience in a DHP office, what that entails, how we work together as a virtual practice, it's going to be at a DHP Transformation Committee that's really going to be the heart and soul of that. Dr. Dennis Tafflin and Adam Edelson, who's relatively new to our organization, who oversees the physician practices, co-chair that committee. And I'll ask Dennis to make some comments.
I'd like to preface my remarks telling you I only have one additional slide. I represent the Practice Transformation Committee, which at this point is made up mainly of specialists and primary care docs, and will be expanded in the relatively near future. It's a newly minted committee whose charge is to assist all practices, specialty, primary care, owned, independent, and trying to help to make all the practices successful or stay successful. We're attempting to look at ways to develop handling the hassle factor of practice and the burdens of operating our practices. Examples would be the new fingerprinting, things that we need to go through, the ID badges, now the super HIPAA in order to meet compliance from the government, and ICD-10. And we're going to try to figure a way to handle this through a survey, which I'll get into in a few minutes, which will need to have the input of all the physicians or many physicians, as well as the office managers in the practices. Examples of other things that we can be helpful for MSO services, such as billing, health insurance, malpractice insurance, where we could go in as a group and be more effective, have more clout in negotiation for these services for our practices and for our employees. The ultimate goal of our organization is to brand the DHP practices, but the committee has realized that we need to start with the so-called low-hanging fruit. And what we're going to do is circulate a survey, which is going to be either online or in paper. And it's really important that everyone tries to fill out, there it is. And there's on your table, the green sheets. There are the different types of categories of practice management, practice operations, et cetera. So we try to make the survey somewhat easy to fill out. Hopefully wouldn't take too much time, but a great amount of thought. And lastly, I'll repeat once again, it is important that all the practices participate in this. I think it's crucial that the docs, the office managers, all spend at least some time looking at this, getting it back to us so we can collate the information and move forward with our committee to make all of our practices successful and stay successful. Thank you.